Are you stepping into the world of medical coding and you're excited and motivated, but also have some butterflies because you've got just maybe a little bit of uncertainty? Well, there is one thing that can make or break your success in the medical billing and coding field, and I'm going to talk about it today. It can transform your journey, and it is something that every medical coder should have, so let's get started. By the way, if you're new here, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, I highly encourage you to subscribe and hit the notification bell so you can get alerts when I post new episodes. Let's start with what is medical coding. Medical coding is the process of reviewing medical charts, records, information, and abstracting all of the different procedures, diagnoses, services, supplies, and converting them into different codes. This is extremely important for two major reasons. Number one, in order to get paid for those services, right? So insurances have different algorithms set up. Like, let's say you are having an EKG. We're going to look for the procedure code for the EKG and then make sure that it's attached to something that would explain why you're having an EKG done. You're having chest pain, you're having atrial fibrillation, not that you're having pink eye, right? And it's easier to set up those different systems of, we're going to pay for this procedure code with these diagnosis codes if everything is a code versus a textual narrative. Second is data and budgeting. We need to know how many patients are developing certain diseases, if these certain services that they're receiving are helping them with those disease processes. Even things like if there's a certain type of cancer that seems to be developing in a certain region, then we know that, and we know why, because we have that codified data. Now, medical coding is a great career. It's very secure, it pays well, but the one struggle that most medical coders have is difficulty finding a job. Now, first, I want to preface this by saying that this isn't exclusive to the medical coding industry. It is very common for people to get bachelor's degrees, master's degrees, and they still can't find jobs, or jobs that are equivalent to the amount of education that they've had. But as you can imagine, the people that finish their training and get a job right away aren't as quick to go on social media and say all the things about how great it was and how quickly they found a job, versus the people who are struggling to find a job are going to be a lot more vocal. So there's going to be a higher amount of those people online voicing their frustrations. So the number one thing you need in this career is a good job finding strategy. Now let's talk about the important factors in this strategy. First and foremost is going to be having a well-crafted resume that is personal to you. One size fits all might be great for hats, like this wonderful one you can find in the Contempo Coding merch shop, but one size fits all does not work for resumes. They should be crafted towards you, your experience, your goals. Now, this doesn't mean that because you have no prior medical billing and coding or even healthcare experience that you have nothing to put on your resume. You really need to focus on the transferable skills, things like customer service, being able to follow guidelines, and highlight things that you did that were really like above and beyond your job description. You want to focus on your skills. Is there certain software you're good at? Is there certain training that you went through? Your experience. So do you have any experience? Is there anything that's transferable, like, again, customer service, things like good communication skills? Did you win any awards? And of course, your certifications. At the very top of your resume, where your name is, if you have passed any certifications like the CPC, it needs to be right after your name. So instead of just Mary Smith at the top of your resume, it should say Mary Smith, comma, CPC. There's a lot of tools you can use out there to build resumes. You can use Microsoft Word, you can use Google Docs, they have templates. You can use Canva if you want something that's a little bit more fancy, probably not needed for medical coding, or you can just pay someone to help you out. I recommend projectresume.net. I've sent them lots of my viewers. Tell them that I sent you. There's a little drop-down box, put my name in it, and they will help you draw out all of those wonderful experiences that are transferable to medical coding jobs so that you can really pop for those different recruiters when they're typing in what they need in their database, and your resume will float to the top. If you're doing it yourself, just make sure that you use a clean format, a professional format, and keep it to 1 page, 2 at the maximum, and don't overload it. So maybe for each job that you have, focus on like 3 bullet point things that you've done. The next thing you're going to need to do is master the interview process. So once you've gotten in and you're going to have that interview with the hiring manager or someone in the coding department, you really want to be prepared for those interview questions. Some of the top questions they'll ask you are things like, tell me about yourself. And this is where you want to focus first on your job skills. I went to school here. I'm really interested in medical billing and coding because of this. This is the certifications I have. I find this work very interesting, and share a little bit about your personal life, but not too much. You could say maybe something like, have kids, I enjoy camping, but you don't have to detail about everything you'd like doing on the weekend. But do share the things that excite you and that you are passionate about. Next, they'll probably ask you about your experience with different coding systems. So do you know ICD-10-CM, CPT, HCPCS, but also things like what EMRs have you worked with, right? Those electronic medical records. What coding programs have you worked with? Was it Codify? Was it 3M Encoder? Have you worked with Select Coder, iCoder, all of those different applications? A lot more employers are looking for team members that are able to use digital tools. They don't like to have to purchase all of these paper books every year and have them shipped out to remote employees or even shared among their in-person employees, and then they throw them out and then they have to figure out where they're storing them. So they really want you to be more familiar with the electronic tools. So if you've been working with electronic tools, definitely let them know. Third question they like to ask is, how do you stay up to date with all the different coding guidelines and changes and up-to-date information on insurances? So this is where you want to talk about your continuing education. If you're involved in your AAPC chapters or your HEMA chapters, if you're involved in taking different courses, if you're going to different seminars or conferences, even things like reading Healthcare Business Monthly. That is a good thing to mention. Say, hey, I'm an AAPC member. I get Healthcare Business Monthly every month. I make sure I read through it to keep up to date on what is going on in the industry. Fourth, they might ask you about a time you had to work with a difficult physician or work on a very difficult coding case. Sometimes they like to ask this to assess your calmness and your ability to work with others or your ability to research. So for example, they might be testing to see, are you able to research independently, right? They want to know that you as an employee are going to be using the appropriate resources available to you. You're going to check the CPT guidelines. You're going to go to the CMS website. You're going to check those LCDs, NCDs, and CCI edits that you're going to appropriate resources. What they don't want to hear is, oh, well, when I have a difficult case, I just go and phone a friend or ask my manager, because that means that you're going to be someone who's going to be a little bit more labor intensive. I'm not saying that's a bad thing, but there's too many employers, I think, these days, unfortunately, that don't want to take the time to handhold people, especially with little things that they should be able to research themselves. So make sure that you make an effort to say, you know what, I will exhaust all of the resources that I can by self-searching. I will check, all the official guidelines, the resources that I have, Codify, Find a Code, Select Coder, whatever you have, CPT Assistant, Coding Clinic. And if I can't find what I need, then I will ask for my manager or supervisor if I'm not able to make a determination myself or we don't have a policy on it. And then fifth, they may ask you why you want to work here. So speak not only to why you want to work in medical billing and coding, but also that specific location. Research them ahead of time. So if you're looking at a job with Optum, for example, research a little bit about Optum, say that you've heard good things about them, look at what their company philosophies are and say, oh, you know what, I want to join up with you because, and then basically regurgitate whatever their company mission statement is. If you know what their mission is and you can say, yes, my mission aligns with that, it'll put you in a more favorable position. Remember that interviews are not just about give me the job, it's about connecting. It's about assessing that this is the right job for you as well as a good fit for them, and showing how you can add value to the company. Now, last, you want to have that job finding strategy, knowing where to look, because some of the old-fashioned ones that we used to use back in my day, Monster.com and Career Builder and the classified ads, like those aren't the place anymore. Of course, now there's the standards like Indeed.com or Google Job or LinkedIn. You can even search for jobs on LinkedIn. In fact, I will link below where I have a video where I discuss how to search for entry-level jobs. But it's not what you know, it really is who you know, and the better you can network, the better you'll know about those opportunities that maybe aren't even posted yet. So connect with fellow coders, attend events, even virtually, if you can connect with your local AAPC chapters, and talk to the people there. Talk to your chapter officer. Say, hey, I'm looking for a job. I just passed my certification. Does anyone know of anything? Oftentimes, if you connect with their Facebook groups or Facebook pages, they will post job opportunities there. EAPC has a board as well of job postings you can check out. But really, I have to stress the networking, the local chapters, and even LinkedIn. Set up a profile on LinkedIn. You can take a nice headshot with just your phone and do a selfie and some nice natural lighting. A lot of people are using the AI headshots. I thought these were super cool at first, but I've kind of turned on them a little bit because now I'm seeing people with these fake AI headshots and fake ChatGPT posts, and I'm like, you're practically a bot at that point. But build a nice LinkedIn profile, connect with leaders, connect with managers, connect with others in your community. Like their posts, make thoughtful comments on them, share information or insights, or even, hey, share my channel. Like when I post videos, connect with me and share my channel. I will love you for that. Another way you can network too is by finding a mentor. The AAPC does have a mentorship program. I will link that below for you as well, or you can just go into Google, type in AAPC mentorship program, and they'll connect you with someone. Now, it isn't the mentor's job to be your headhunter exactly and find you a job, nor is it their job to teach you everything about medical coding. It's really to have more of a career coach sort of relationship with them. So be a respectful mentee and be a respectful community member, and you'd be surprised what job opportunities will come your way. So resumes, interviews, networking, these can all lead to success for you to find a job. It is really the secret sauce. And AAPC chapters in itself are like the secret sauce of how to be successful, because they offer so many opportunities, surprising opportunities that you would not expect to elevate your career. If you found this video helpful, make sure that you share it with a friend. And if you need more resources on how to find a job in medical billing and coding, I have an entire playlist of resources right over here, including some great interviews that I've done with recruiters. Definitely check that out. I will see you guys in the next video, and until then, just keep on coding on.